Okay.
Where does that go when it's recorded?
It goes, I think Maribel gets them all and it goes up on YouTube.
Great.
On the OCAM page, as far as I know, I think all of them are recorded, so.
Out of space. Everything ends up up there.
That's what it is. It's in the cloud. So like I said, it's being recorded. Hopefully I did it correctly. I'm used to just doing it on my computer. Ari should be here in a minute. We have a packed agenda, so we want to start with Maple Ave. When Ari gets here and give you at least, I don't know, 15, 20 minutes
Yeah,
for whatever.
the engineers,
He's supposed to be here.
yeah, he's supposed to be here.
Yeah. I just talked to Julie and he said Michael's supposed to be on.
Yeah, I saw him this morning, I saw Julian this morning. I can do a quick overview for folks, so the last meeting, we were discussing an advanced Presby system. Since then, the new design includes it's called a FAST system. So it's basically a pre-treatment system prior to it going into the advanced Presby system. They use those a lot down the Cape where they have nitrogen removal issues. It enhances the quality of your wastewater. And then the Presby system, which in some instances can be as close as 2 feet to seasonal high groundwater. In this case, it's 4 feet, which is the norm. Because the offset to 2 wells can't meet the minimum 100 feet. So you can't get that a lesser of an offset for the Presby. And the other thing that I'm recommending is that we get a baseline water test on the affected wells, a Title V scan, so we have a baseline moving forward. Considering the, site constrictions, no town sewer, no access to other properties to be able to get the distance. This is more than adequate to deal with the wastewater that will be coming from this facility.
And Phil, there was a question on whether you should combine those two systems together, that it almost over-filtrated it. Did we figure all that out since the last meeting of the pre-filtration plus the
Presby,
that they can work together?
I mean, it's added protection. And then where your lot is, so small. Sir, yeah, you probably should, this is Doug. Oh,
Okay, no, I'm just like,
is he locked in?
he might be.
Wait till it comes back.
I don't even know.
I can never figure it out.
Anybody?
Mike,
Where's he come?
well, they were probably at the other door. Cause there's 2.
Someday I'll figure out how to unlock the door.
Hmm.
They're not.
Yep.
Made it. So, I mean, it's added treatment. And, in this situation, where you have 2 wells that can't meet the 100 feet, it certainly, I would think, answer those concerns.
Mhm.
So I was just giving an overview from last time.
Yep.
And then the FAST system.
Yes. So basically, we added the fast system in line with the Presby system that we had originally recommended. Generally, everything else stayed the same, and if there's any other additional questions from the board, or
It's basically the best system you can put in for the lot we've got.
it's fairly robust system for a single family housing unit.
Right, that's what my research showed. I mean, I used AI to check that out. That's good to me.
Yeah, he's always correct.
And well, I also looked at the
I-
references AI provided.
I
that
love AI.
clicked on.
There was one question, about the baseline water test. The previous, you're the new homeowner.
Yep.
Yeah, so. Did you, was he that he texted me, not you, or was it you?
That was Greg who texted
Okay.
you.
So,
Yeah,
he
he brought
basically,
us up to date on everything.
he said, who would take that test? And I had recommended, I talked to Julian today. With notice, have the engineer take the baseline test for both properties. Because we want baselines for the.
And what is it, just a bacteria nitrate test?
It's a Title V scan, so it has nitrates, nitrites, coliform. If you get any, you're gonna have a baseline, so you'll know where things stand at this point. I mean, most of the things that happen, that we get in certain drill wells, we get high iron and manganese around. That's not unusual to get iron and manganese, so. But it nitrates, your nitrites, coliform, obviously, coliforms, so. And they can be taken, out, you don't take it from a hose, but you need it from a free flowing tap, one that doesn't have a screen on it. So it could be taken from an outside tap, doesn't have to invade, not that you're gonna invade the house, but so that would be the other provision.
And when does that need to be done?
I mean,
Well, the water test it should happen prior to construction.
Right, there's a note on the plan, that's one thing we did, add a baseline water test is to be provided from both wells within 100 feet of the subsurface system. Prior to
And you
construction.
know who to use for it.
There's a couple.
I
I
said
Mass DEP approved.
There's
companies that do title.
Neshoba,
Yeah, Neshoba's Analytic.
they do a lot of them in the areas, Howard Labs, but they're further, Belchertown. This has to be a mass approved.
And who schedules the water test?
That would be between,
I'll have the owner of the property. I'm
Yes.
just representing the construction,
Okay,
so I'll have the.
I just wanted to make sure
Yes.
Yeah, the owner of the property will do the, I guess, both water tests.
Okay,
this would notify the property owner so that they would know.
yeah, so will he need my number or what's
I
the
can,
best?
if-
Sure,
as long as we, maybe we can put it in the minutes or
Sure,
something. I
yeah.
can- Or I can take it if
yeah,
you want right now,
yeah, sure.
whatever you want. I'm Mike Cook, by the way.
Yeah.
I'll text you if that's easiest.
Yeah, sure.
What's your number?
508 736. Wait, 57.
And sorry, your first name?
Jay.
If OCAM texting. Should have received a text from.
Yeah, got it. Thank you.
Okay. So I'll coordinate. Work with you to get it scheduled.
Appreciate it.
And then the fast system. That has like an annual maintenance.
There's a maintenance program through the manufacturer.
Yeah.
Offers maintenance, which. And we sent everything to the owner.
Yeah, we're gonna plan to resell once we're done, so we'll pass along to the owners, the maintenance schedule.
They go in, they check the system, they do some, take some samples, usually as a report that's sent, the Board of Health gets a copy. Usually, so if you see, it'll mention the site, the address and the site,
Right,
and that's also public record.
usually it's lakes, but Anything else? So it's settled?
So will there be a second test? I mean, after it's installed, or how does that work?
I would recommend another test. Depending, well, we could put the system in and no one's
gonna use it for a
no
year,
one's in the
so
house.
I think, Jay, at that point, it's sort of like you test.
Okay, how
Um,
much, does anybody know how much those tests cost?
I think for like
it-
$150.
Okay,
Yeah, it's not a full, the chemical tests, and I'm blanking, that's a really, you're getting all your arsenics and all that, some towns require that. It's like 100 to 150.
It's basically impossible for this to
yeah,
be an issue.
okay, all right.
Unless it's not maintained, unless the maintenance schedule's not.
Even then,
And
That's the
with this
responsibility
system,
of the
there are
property owner,
reporting
yeah.
requirements. Because it's a DEP approved system.
Right.
There's reporting requirements that come along with us. When we submit this paperwork, it says we're using this and we will abide by the maintenance schedule and the reporting requirements, which is all handled by the company that will do the maintenance.
and honestly, even without it, like the Presby systems are,
So
They're
who is it? I mean, do you know who it's reported to? How does that work? Just because we want to
Board
make
of
sure
Health.
it's
Mhm.
maintained
Here,
and
comes here.
reported properly.
Mhm.
I mean, I believe
Board of
that
Health, yeah,
it's a great system and everything, and
Yeah,
I
it's
appreciate
cool to
that.
get it.
Get
Um,
emails usually with the water reports in them, and then they
Okay.
go into the record. You can,
Okay.
you can request it,
Okay,
but we're a part-time board, so don't expect something right away. Even though usually we get it quickly.
okay.
One of my.
And I'm new here, so I don't know what's going on. We were in my first meeting.
Grafton, one of my towns, has a lot of condos and they have a lot of different fast systems, and those reports come through. Basically, they're pretty straightforward. They'll say, if something's out of compliance, there'll be a checkbox. They're pretty standard, be able to read. They're not like this big, huge document, but it has a checklist. So if something's out of compliance, they'll state it. And then they'll have a corrective action. They have to change something.
I think the nature of my question was really like, how stringent do you have to adhere to the maintenance before like failure, right? And I think you answered it, is that you could neglect the maintenance even if.
Yeah, but
Yeah.
they're gonna have to do it annually, otherwise you guys are gonna issue an order, so.
Okay.
Mhm.
Or whoever, if I keep it, I gotta do it.
Anything else on Maple Street?
I guess, what's the timeline you guys think of getting that installed?
I'm gonna try to move now quickly. I haven't even begun. I'm gonna use Amadio to do it, Mike Amadio, so it depends on his schedule, but I'll try to get going as fast as I can, because it's holding up all the plumbing and everything.
Okay,
So as soon as I get home, I'm gonna be calling him to try and figure out, once I get the plans, I don't even have the copies of the new one.
Is it Mike, is it Amadio's gonna put it in?
Yeah, Mike.
Yeah. He's an installer, works, he's from town, he's done a lot of work, does good work.
Oh, yeah, no, Mike.
so, copy of the plans, do you have that there? Is that on public record?
Yeah,
Yeah, you just have to ask for it. I
Yeah, yeah.
can get it for you,
Okay,
public record.
or someone will get it for you.
okay.
As soon as they're reviewed and approved,
Who do I contact to get a copy of those?
Email the Board of Health.
Board of Health.
Okay, what's that email?
Or do you want me to just, these are the copy, it takes a minute to copy because we don't have a huge copy machine, but these are the new,
should be a single sheet, the PDF one that I signed off on.
there's like, I got a packet this big.
Yeah.
So I just threw it in a folder.
Yeah, I mean, I don't.
It's
I trust,
hyphen
you know,
MA dot
that
gov.
Things being done properly, but just, the.
Yeah, email, because I can scan it in and email you a copy.
Okay, what's
Yeah, no,
that email?
It's BOH for Board of Health at OCAM.
Yep.
Hyphen MA. .gov.
Okay, great.
It's stupid, look, because my font's so big, it makes it look like there's another hyphen. It's really just because I'm blind now.
It's Palmer.
No, I contacted them. They're bad.
Jay Thistle,
What's up,
how's it
Mike?
going?
Good, how are you?
Michael Poitras.
Yeah, I was like,
I was like, oh, it's been a
Oh, this
while.
guy.
I don't see that
Yeah,
single
I
copy,
know.
so I should actually sign off on these. These are the revised things. Yeah. these
Yeah,
are-
those are all the revised ones.
And there's actually. We'll make sure, oh,
You need one, Mike?
it's an extra, there'll be an extra one here for this.
Yeah. I think we had a whole package
Do I
at
just need
the
to pick it
office
up?
for you too, but
Okay.
I can give you this one to leave if you like,
All right.
just to get started.
Yeah, that'd be great.
And I would recommend you call these guys sooner than later.
Okay. So you
Those look
got-
the same.
Yeah, you got,
Well, I got 4 copies.
you got 4 copies.
Then, but
Let me sign these off. And then you could let one go.
Okay, I can give you one. I can give him one of these, right? If we have,
Yeah, I mean, normally. We ask for 2, one I mark up usually, and then one you keep as an extra in case you let it out and
Yeah.
doesn't come back. Most of the time I get PDFs, so. It's a single sheet, although this is easier to read because it's bigger.
Yeah.
you have everything we need so far?
Yeah,
Okay,
yeah.
I figured we did. All right, but we would get you anything
it's
else.
a pretty substantial packet I received a week or 2 ago, so it's.
Everybody all set?
Yeah, I'm good here, yeah.
Okay,
Yeah,
thank you. Nice to meet you.
Yeah, nice meeting you.
Good
Really
luck with
Thank
appreciate
you.
it. Yeah.
Thanks a lot.
Yeah.
Nice to see
All
you.
right, so this issue's all.
Yeah,
wrapped up
settled.
here? Okay, all right,
Thanks,
great.
guys. Yeah.
Yeah, you might as well just take one of those.
Okay,
Thanks,
Phil.
all right, thank you very much.
I have enough.
Oh, yep.
My number
Okay, sure.
in case.
It's on the Board of Health website. If you go Google OCAM Board of
Yep.
Health, it comes up with his phone number as well if you lose.
Okay.
Not that you're gonna lose that piece of paper, but.
All right, thanks a lot, Phil.
Thank you. Thanks, Mike.
Thank you.
Thank you.
Oh, yeah.
Okay.
If you want that for
Yeah.
now.
And then I just never stopped.
So we kind of went out of order.
That's okay. That's fine.
I don't know how you want to address the minutes.
Oh, you-
I was literally the only one here.
Okay,
so-
good.
Oh, okay.
Motion to accept.
I,
I don't know what to say.
You might, just a suggestion, you might want a motion and to approve.
Yes, motion to
That way
approve
it's in
the,
the minutes.
Maple Street dispute,
67.
Maple Street, yeah. No, the minutes was, the last discussion about this tight tank was over an hour long. Were you hear that? You weren't here, right? So. This is a summary of what occurred. I was the only one here, so I don't know how to tell you that this is what. Great, but yes. Those are the minutes.
Do you have another clerk lined up?
They didn't fund one, so no. Right?
nope, took it out of the
They
budget.
They took it out of the budget.
So what do they expect?
I have no idea because if, I can't do what she does. She
You
does
you need
everything.
you need an admin,
Well, we don't have it.
because they're gonna be calling me and I don't have any access to anything and I don't really want access. I can keep the work going, but
Yes.
beyond that,
Yeah, we're gonna talk about that
Mhm.
to see what's gonna happen. I can send you something now. I appreciate everything you do for me.
Just tell me. What she does, everything. Oh, he is Phil, you want to tell her what you do?
pardon?
Have you met Liz?
Oh, I'm sorry. I do the field work for the Title V. You're part of the Lester Alliance. They
Yeah.
take care of everything else, but I specifically just do your Title V stuff.
Okay.
So your perk tests, your plant reviews, your septic installs. Review your installers when they, are licensed. Basically just keep the jobs going. One of the biggest things, the admin takes care of all the paperwork, so, you need to have online, all your applications, your installer licenses, apps,
In person.
And then,
Doing.
realtors are always calling to get your Title V on a property.
Oh, I have a
They-
couple I have to look
Yeah,
for
they
tonight.
email and call all the time, and
All the
they have
time.
like a very, they're like expecting it turned around
Like-
within like 2
like-
days, and it's
like this.
excessive.
Yeah.
Yeah, they want it like, they're like, oh, I need it for Tuesday.
Or if a property goes up for sale and
Yeah.
it's not represented or something, all of a sudden, you have anything on this property?
Yeah.
Title V inspectors will call to see if you have a septic plan on file before they try to do an inspection. Your pumping records come in,
Mhm.
that's the paperwork of the business of people's property. And in Ocam, there's no sewer. So everyone has their septic. So if property goes up for sale, they're gonna get a Title V. And if it's conditional pass, needs further evaluation, that all comes through the Board of Health.
And the
But-
records are all paper in here?
Yeah.
Okay.
But they get
Well,
scanned into
they
as
get scanned in
SharePoint
here.
online, that
Yeah,
I
that's
can't get
why-
access.
That's why I
Oh.
said get SharePoint.
I can access it, I just can't because of my work SharePoint, which makes it complicated to get to.
Oh, okay, so that may,
It complicates it for me.
okay.
Yeah. Did you
Um,
get your email and
No, because
SharePoint
the way that
access?
they're doing it is instead of like, so she'll just probably get the password to this like Board of Health email, and it will just be like, because it's expensive to give everyone a license, right? And you can buy whatever company, say Ocam bought 10 licenses for office or
Oh,
whatever.
yeah, yeah.
So
okay.
instead of giving everyone an
Yeah,
account, they're just
I
gonna
know
share
that.
an email. So instead of giving Liz like Liz, whatever your real
Yeah.
last name is. Because I don't know, then it would be like, you would just go for the Board of Health one, so you just have access to
Okay.
that. And then
Alright,
it's
we'll
very
have to
easy to
figure
get,
all
like I
that
have it.
out. Okay.
I mean, I work from home. I was thinking if we're addressing this item now, is that, I mean, I'm local
We-
and I work from home. I
Oh,
could
yeah,
try
we
to help
can
support
address-
in that way.
Yeah, and because I can explain what I do, Lester, she can give you an overview of
Okay.
what they do. Thanks, Phil.
Okay.
The biggest thing is you need someone that's gonna check your emails and check your machine and then be available, whether it's an hour or 2 hours a week, to meet with people to either give them something or
Mostly everything can be done via
Through
email.
email, yeah.
Okay.
So it's just when something's not in the share, there's like a archaic filing cabinet system in there.
Okay.
And every once in a while, when something's not in the SharePoint, you have to go and look to see if it got missed during the scanning.
Okay.
which Does happen.
There's not a lot, so there's a lot scanned in because I've kept it up to date, but if it's not scanned in, it's in the paper file. If it's not in the paper file, then we didn't
We
get a
don't have
copy
it.
of the septic. And usually a couple times I'll have to tell them you have to go to the company because they didn't send it
And
to
it's
us.
also
Okay.
sort of confusing sometimes with the property number, because when there's no number on the road, they just go with 0. So then it could be filed in the wrong spot. So if the property was then renumbered, it might be under a different
Like
number.
mine
which-
was 7,
Right.
even though that's not my address
Right.
when it was being filled. Okay.
Right, so
got it,
that is
okay.
also confusing when you're looking things up back there.
or
But we have to do our best bet to
Your
find it. and
infamous lot ones,
Lot ones, yeah,
Yeah.
so you just start
Yeah.
at the beginning. and
lot
then-
ones and lot twos,
Yeah,
Okay.
sometimes threes.
Yes,
Okay.
so.
okay, all right, let's,
Did they just arbitrarily cut?
yeah.
No, there was lots
well,
of,
there was a few
there was like,
cuts.
they had to make some budget cuts to make up for
You know,
some
'cause
deficits.
Ocam doesn't plan ahead, so they just cut whatever they can to make their deficit. So they don't like to plan ahead not us, I'm a planner, but the select board doesn't really plan, so they cut all kinds of stuff. Yeah, it's
Oh,
too
that's-
bad, but what are you gonna do?
Well, you have to make budget cuts sometimes. I mean, new governor, new budgets, it just goes with the flow, unfortunately. Your position is.
Also, with
but-
me,
Thank you,
Yes,
Phil,
I like your
appreciate
hat.
it.
good luck, got my
See you.
number.
Take
See
care.
you.
All right.
So. I'm glad you could come from Leicester, so,
Congratulations, by the way.
Thank you.
So exciting.
yeah, so You'll be going, I got an email.
Yeah, you're leaving July 7th, if
Yes.
you make it that far. You're like, I might be here longer. I'm like,
I might be,
girl,
who knows? I don't know if time permits, but I'm saying July 7th.
right, yeah.
And my name is Michelle. I'm going to introduce myself, Liz. Nice to meet you. Welcome. So a little bit, can I provide a little bit of
Yeah.
background what
Yeah.
we do? So Leicester Regional Public Health Coalition, or LRPHC, we are a regional coalition or collaborative that supports 8 towns. Those include Barry, Brookfield, Harwick, Holden, Leicester, Oakham, New Braintree, and North Brookfield. Got them all.
Mhm. It's a lot.
And what we do, this coalition is funded through the Public Health Excellence Grant through the state, or DPH, and we provide supplemental public health services. So a lot of it includes inspectional services. Kind of Phil gave you kind of synopsis. He does Title V. We also do food, nuisance, housing, camps, trying to think, pools, anything public health related. And we also provide a lot of services or community outreach to the residents throughout the region. So we have blood pressure clinics that are regional nurse. We have one regional nurse that provides it to the town. So she comes every 4th Tuesday of each month, alongside with Miriam. She's the shared service coordinator for the PHE, or the Public Health Excellence Grant as well. And they've been providing SNAP resources, but also more so resources than anything. A lot of people have come in and asked, like, any heat resources, any housing, and it's been very, I want to say it's been active. Since based on what they've said or they reported to me. But we have in our staff, we have a regional nurse, shared service coordinator, a regional epi, a regional inspector, and a regional administrative or admin. It's been, I started in October. It's been great. I feel like we expanded some services. We're doing Narcan training as well. Our epi was trained to do that, so he's been leading those. And I wanted to say, if you guys are interested, let us know. We would love to post here as well. Yeah, that's a great synopsis.
Yeah, it's good.
About it. But yeah.
Answer any questions we have when we don't know what we're talking about.
Yeah.
Complaints about rubbish. That's a big one that we do here, with the one downtown and
Yeah.
the one
Yeah.
over there, Bullard or whatever.
Crawford.
Crawford and the center of town. Those are our 2 most reported public health hoarding situations, if
They-
for lack of a better word.
They've been to Crawford numerous
Yeah,
times.
They have.
Now, the Colebrook, what's the number for Colebrook? Is that like
I don't know.
one?
So that,
Have you, I
Should
don't know if
we-
you've had,
so that's the one with
Um,
the rats.
that's the one with the rats. I feel
So
like.
we got another email. So I check the email, as soon as an email comes through, I get it. I see it on my phone. So we did get another town person concerned about the rats. Obviously, it's warmer now. And so the last thing I think we had talked about was we had been looking for the property owner and sent them like a certified letter, but I don't think there's been any follow-up since
Yeah,
that time.
Mackenzie, I sent it all to Mackenzie.
Right,
So
so we really like that.
she's emailed me back. That's why it's on here, so I
Yeah.
could update you. She is trying to find some dates. She really thinks this is something from the AG, for the AG's office, Attorney General's
Sure.
office, Crawford and Colebrook.
Okay.
There were a bunch of dates in June, but
It's
no, it's June now, May.
It's
April
July
or May,
already.
but we didn't meet.
Yeah.
Nobody really was around.
We were waiting
So,
for the election, let's be honest.
she hasn't gotten back to me with dates yet. So it's kind of on hold until we can meet with or you guys can meet with the AG's office.
And that's because they've been unresponsive to our,
So we've asked them to
request.
clean up, we've
Yeah,
gone in and done
okay.
inspections, like there was like a well visit on like the people living at Crawford. This one over here is
It's not- yeah, I
uninhabited,
was just
so
gonna
it's just
say,
like
okay.
rats because it's not taken care of.
Great.
And so we've like sent them letters. It like took a while to find the property owner and then we sent letters and they were like unanswered. So at this point, there's
Okay.
like not much we can do. Our hands are kind of tied. We've had pulled Lester in for assistance.
Yeah.
It's definitely on our radar. It's something we're concerned
So
about.
just
but-
look for emails. I'll let Mackenzie know to make sure she emails the Board of Health
Mhm.
when she has dates, and then you guys can take it from there.
and I'll get access to the email.
But
So I would, I would
You gotta
again, I'd
talk
reach out
to-
to Maribel and just be like, oh,
Okay.
we talked about it, just can I have access to just the Board of
Got
Health
it,
one?
okay.
And I have access, but I have absolutely no idea what the password is.
Okay,
So I don't, like, if it gets reset, fine, just let me know what it is, because I have it.
okay.
I don't know, like, I have my own, they gave me like Ariana.O'Neill
Oh,
at
yeah.
Ocam, you know, but I don't need that either. If they wanted to yoink it away from me and just give me the Board of Health one, I'd be fine with it. I'm like as soon as an email comes through, I have it like here, so that if it's like an urgent thing, like
Okay.
I know right away, oh, I'll just like, we'll say, oh, we need this request, and we'll write it down and try to find it.
she
make sure.
usually texts me.
Right, yeah, to make
Because I
sure.
usually do all the requests.
She does it once a week,
Okay.
usually, like she sets time away, or I don't know how often she does it, but she sets time aside,
It's like
so.
3 or 4 days a week.
Right, but I just
look
wanna
at it.
make sure
I don't
that-
have it on my phone. I have my work on my phone and that's all I can
Mhm.
handle.
Right,
Yeah.
so,
Does the grant cover administrative support that could help with some of the duties if we took some and?
Well,
Like-
somebody would have to come to OCAM.
Mhm.
Like, we're not gonna give them access to the Board of Health emails to check and do that because they already work for 7 towns? So we get it, make sure I have all the paperwork. So I'll just tell you what I do, just so that, because I don't think we should ask Lester to take
Oh,
on more
I
than
mean, I'm
that.
just asking, cause I
Right.
don't
So
know.
usually I look at the emails, make sure they have all the paperwork for food permits, camps, you know, not anything that's not Phil's.
Yeah.
You have to make sure they have all the paperwork, unless you have to ask them for something they're missing. There's a list, which I have somewhere in SharePoint that came from Megan. Send me a list of everything I need to make sure that they have. I forward it off to Megan. And then Mackenzie does all the inspections. And then Megan sends me all the paperwork that it's approved, inspected, and I put it on SharePoint.
Okay.
So that's and then if someone asks for Title V's, I look in SharePoint. If I have it, I email it off. If not, I have to stop up here and look, scan it in, send it off.
So I'm just asking like if that grant would cover the payment of, they don't like, it's not a possibility. Okay.
I mean, every town, I feel like, and this is why some of the admin, which we had conversations when we had our whole budget review, when we found out that COVID was not be part of the grant, and then it became part of the grant anyways. I think towns should be responsible in doing the payments, just because it can get confused with having people going all the way to Leicester. I don't think it's ideal either. Yeah.
I mean, these are obviously questions. I'm just as an outsider
yeah,
coming
yeah,
in, I
of
just
course.
didn't know if there was
Yeah.
any opportunity there. But I mean, I'm happy to do what I can. Since I'm like
And I
in
know-
town most days,
Right.
happy to take on what I am able to, once I
Wow.
learn more.
I mean, in a couple weeks, you guys are gonna have to. I mean, I'm turn in everything and say, there's nothing else for me to do.
Mhm.
I asked Maribel about the stipend.
right, it's like weird, it's like say there was like $700, it's just divided by the amount of people.
Yeah.
But whoever's doing the most work, that's why Aaron always got a little more. The stipend is not something, I'm not like, ooh, yay, $150. So if someone's doing the work.
Not a motivating
Right,
factor.
the person should get
No,
more of
no,
the
it's
money.
usually not a motivating factor, but it's nice to have the little extra for the hours I do put in, which is usually, I mean, it's 10 hours a week
Yeah,
that I've been
that's a
putting in.
lot.
It is.
Yeah, I'm
That's
just
what it
saying,
was
like,
budgeted for.
I would rather.
Between
go to
meetings, like
someone
this
who's gonna-
meeting, I go to the Leicester meetings.
Mhm.
Like I went last night,
Mhm.
just to get caught up on everything and in case there's anything we need to do. But then we also get like I just had to go upstairs and look in the inventory and fill out a spreadsheet that we still
But
had.
was it,
stuff
was
for
there a lot
grant.
different or than
No.
what was on the spreadsheet from last year?
No, it's,
The same,
everything's upstairs.
right? We made it last year, so it should be like nothing changed because we didn't really get
Yeah.
anything new.
So I
this
had to
year.
fill that out for somebody. It was a whole big spreadsheet, which had more information than I thought on it, but. And then I had met with, what was her name? We did that other spreadsheets that we had to fill out for, I forget who it was, for Lester.
Those spreadsheets.
Yeah, all those questions. What was her name?
Oh, for the Foundation Public Health Services.
Yes.
Yeah.
So there was a
Yeah.
bunch of that, so.
All right. So
So
are
just-
you done completely or are you considering taking the third seat?
I was considering taking it, but
I mean, because we'd love to have you. You're obviously the content expert, clearly.
And
You're
then we
doing
could
all the work.
redistribute.
Yeah, we could redistribute like the stipend and
The
we would have
work
to vote
and-
on the chair. I hate to say this. I'm never in this town. I know I live here, but I'm like, cause
Yeah,
you know where I work so far from here and
Yeah,
like
you
it
do,
literally took
yeah.
me an hour and 45 minutes to get home from work today.
yeah, that's wild.
I know, it's so
Um,
bad. I'm like, la la la, golden handcuffs. Anyway, moving on. I'm a state employee. So I can try to help, like what I do, I like literally check the email and I can help if I can, but getting into this town hall is so hard for me,
Mhm.
which is terrible, I know, but I would be willing to help more, but I would really love for you to take the third seat. You definitely are a valued member of this board,
And-
FYI,
yeah. And
which
then
I
could
hope you
help-
know every time you help us out.
Yeah, and then you'd be able to teach me
Right.
ways that I can help and support.
okay.
You don't have to answer us now either.
Well, I kind of do because Monday is the board meeting, the
Okay.
selectmen's meeting. So if you're,
This is why I messaged you privately and gave you my idea. Just kidding. I would, it would be a shame to lose you because you're an asset to this town. And I just want you to know that.
I mean, I don't want to leave you high and dry either. That would make me feel really bad.
But yeah, as far as the stipend goes, because if there were three of us, then we would have to vote for a chair. And whatever, basically that's just the person that's like getting more money. So whoever's doing the most work should be getting the money.
I don't need any money.
I don't really, I'm like already like, all right, let's
Yeah,
go out
it's
to
not-
dinner. I don't
That's
even, I
what it-
never,
Goes into our vacation funds.
Right.
For our trip to Italy.
oh,
So
good. When are you going? That's exciting.
I
Oh,
know, I'm very
I've been
excited.
twice.
So it's not like, it's not like,
$0.
it's not.
No, it's exciting.
It's not, it's fine. Yeah, I'll take the third seat. I think what
the video.
one of you or both of you would have to do now, I don't know.
I
if
think we have to make a
go.
recommendation to the Board of Selectmen.
Yes,
You do.
and
then-
the clerk was telling,
Yes, Maribel was saying that
no, the
we,
other one,
oh, the
person who swore me in.
Lisa? No, she's gone. I don't know her
Oh,
name.
Christine, was Christina,
Yeah,
was it
I
the
think
older,
so.
I don't know who the
Well,
older
the older
lady
woman,
is.
but she was being taught by the other person. So anyway, she was saying that, telling me about the process, but I've since forgotten it.
I do know that we have to I think we make a recommendation to the Board of Selectmen and then you would be in and for like, is it a year? And then you'd have to pull
Yes.
papers for the next election.
Okay,
And then at that point you would run for like a 3-year,
a
whatever,
two-year seat. Yes, I do remember she told me that. Yeah. You would run for what's remaining of
the remaining
three-year-
of the
yeah.
term. So that would be what you would
okay.
do.
And that would at least buy you guys a year
Mhm.
and then I can figure it out in a year.
Right, and we can, well, the stipend distribution comes out in like around Christmas, so we can redistribute that.
Yeah, that's what she said. It comes out in June.
It does, it's like twice a year.
And
It's like the
December.
fiscal end of the fiscal year for the
June.
state is like June 30th to July 1st, so it's like halfway and then there.
Okay, so do I have to go to the meeting on Monday? Or is it just you guys go and make a recommendation?
Monday, I can't.
I
go,
think it's
no.
the 23rd.
I have a wedding Sunday night and
Oh
I'm
my
like
God.
in it. I'm like performing the ceremony. I have no idea. I could make it, but I want to promise.
No,
like
let
my
me
best
just check
friend's
I
my
think
work
it's the
schedule.
20, right, Monday's the 23rd?
Yes,
yeah.
Monday's the 23rd.
What time is it?
Usually it's at
It's
6.
later,
I
right?
think it's usually 6.
Okay, that should
Seven.
work. I'll be done with my work
Let me
meeting.
see. I'll go on, oh, wait. Oh. It doesn't, that's us, Board of Health, sorry.
That's okay. Don't apologize.
Selectmen meeting, Board of June 26th.
Oh,
Sorry,
wait,
it's at
that's-
10 AM. Oh, wait, that's the highway board.
well, I can email Maribel and let her know that we have a recommendation and
I
see
could
when the
do-
next is. Or
Yeah, and I can do
Oh.
that day as well.
I wonder if they must have just had one. Oh, they had one last night.
That's okay.
But they have, our town meeting is the 24th.
Would have to get it on the agenda anyways. We'd have to contact them ahead. of
Right,
time.
yeah.
Yeah,
I can do that.
Okay,
Via
And then you
I'll
tell
do it via
me-
the, like a legit Board of Health email.
and I'll go there to be
Yes,
the.
whenever the day
person
is.
If you're busy by myself,
Right.
I'll be like, yeah.
Be like, we
Right.
recommend it. Boom, boom.
Okay.
She's great. She
so
does
if
all
you
the work.
email
I just let her
I
Maribel
will.
and the select, just to get it on the agenda
For you,
to know
yeah.
that this is what you want to do, that way they don't like completely shut me off on.
No, I
I'll
will.
keep everything and I'll just look at
Right.
the Board of Health and the clerk email.
Yep.
Because a lot of people know me now and sometimes
Just
they
email
just email
the
me.
clerk.
Can they
So-
can you just forward that like, could you just combine the two to, at
Right.
least for yourself?
Yeah,
Like have one,
like if we're
dress
not gonna have a
code
clerk, we
together.
should probably get rid of
Just,
the,
like, Put a
Yeah.
notification saying, I don't know, kind of like an.
Yeah,
office
that's what
email,
I
yeah.
would do.
email.
Cause I get all the Board of Health ones too. I'm
Right.
on the Board of Health
Right, right.
ones
Me
too,
too,
so
me too.
sometimes I get double.
me too, like, or
Double.
I email
Yeah.
you and I also get it.
Yes, that happens to me too. And this
Okay.
email's not the,
No, it's not my favorite.
it's not the, like. the
All right.
craziest.
Well,
Okay,
that's
so I
everybody.
don't mind doing that, at least to help you guys out,
All right, so.
especially because you have no idea.
no,
I,
just 'cause I've been here
I
doesn't
felt
mean I
so
know.
bad when
don't.
I just, when
Where
they
do we
took me
meet?
off, I was like, oh my
I know,
God.
I was like,
what-
oh my God, by where we vote, but I didn't know. I was like driving from Quabbin to basketball. Oh my God.
yeah.
All right, so that's exciting. Thank you, Sue. You're the best. All right. Are you staying for the whole meeting or do you want
To you.
to? Okay, well, I don't care. I just want to give, so the next thing on here is plan for future events.
Well, I'm wondering,
We can table that if we need to.
do you have any updates for us besides?
This is what was said yesterday.
I know, so like the budget was,
Budget, yes, so budget and FY 26 work plan or the objectives for the year. And budget were approved at last night meetings, which was good. We had a deadline for June 23rd. So that was already submitted, or working on, submitted, I said, submitted to the board. My maternity leave, we talk about that a little bit. I sent out the plan, what it would look like, just a point of contact, just.
I thought, yeah,
Perfect.
it'll be in the, if when you log into the email, it should be there. If not,
Okay.
I can forward you these things once you get access. In the email that I send to Maribel about Sue, I will also be like, could we have general access if you want?
Okay. And just for my knowledge, like where would I be able to see what the objectives are?
Yeah, I'll be happy to forward to the board. I know sent out also to the board. The budget and the work.
Mhm.
And usually towns, what I would ask is throughout the year, it's like sometimes when I request paperwork or documents to review and stuff like that. I mean, it's not necessarily a lot of the responsibilities or the people who are involved in the work plan, it would be regional staff.
Uh-huh.
So those will be leading the objectives and the goals for the year. And our regional epi came back from paternity leave, so he's been working on the community health assessment surveys that we provided a couple months ago, so he's revamping that. And trying to make more of an outreach, so he'll be reaching out soon. Have you all gotten any feedback or anything?
For a request for a survey? I don't think so.
No.
Would it come from one of you guys or?
Yeah, no, I saw that the survey is posted on the website, which was great on your guys'.
I saw that.
Yeah. that
Sue's
was-
great. I saw it today and I was like, she's so good.
Yeah. But any paper, I know he left several
Hard copies.
hard copies throughout town, so he'll be doing his rounds possibly this week or next week.
yeah, I don't think I've gotten any in our box.
Okay.
I don't know where else they would go.
I don't either. Does that?
I think if Maribel got them, she would put them
She
in our
would, yeah,
box.
she definitely would.
So he'll do a round of those, just FYI. We also, like I mentioned earlier, we are doing Narcan training. And if OCAM wants to host Narcan training, we'll be happy to do so.
When you do the training, are you giving out the kits?
Yes.
And it's 2 doses and gloves
Doses
or
and it's like a kit.
is it the
yeah.
fentanyl testing
We
strips?
do that too.
Okay.
Yep, we do the cover or the mask
Yeah, the,
throughout, a lot of the resources, pamphlets, and we usually have the DA come in. And do also like, they'll be tabling on the side and provide some resources to the community, so. We've done a couple already, couple events before, or not events, trainings.
I think I asked you this before, so because I clearly am interested in training like this. I've done it for several groups in town myself. But I think I said to you, it's hard to get a group of people together in OCAM to have enough people where I feel like it'd be worthwhile to have a training, even though training one person could save one life. Barry is not part of the coalition.
There he is.
Oh, is it?
Yeah.
So, because if,
Barry- Various.
Is Barry?
Barry is, Barry. I
Because
think he
Quabbin
was there
Regional
last
High
night. Yeah,
School is the
Barry.
place that,
We did.
so if you did it at Quabbin, then you're hitting our our patients, on that word. Our population.
Yes.
Because other than that, there's not, we don't really have a lot of like everyone, like Memorial Day Parade, you just missed it and it was 50 people and it was great. But you know what I mean? We don't have like, I'm not saying we wouldn't take the training, but
Yeah, is there, I mean, we had the October.
that's not, it's every 2 years and they're not doing it this year. I can tell you that because they did it last year.
Oh, Yeah. And
So the
then-
events, other
okay.
than if you wanted to go to the winery in town, there's really not a lot of people at places. So
Okay.
I'm not saying we don't want the training, but if you hit Quabbin, then you're hitting our,
Yes,
our
yes.
people.
We definitely hit, well, we
And
didn't
the
do
epicenter
Barry,
of
but-
Elias.
Yeah. I know.
Yeah.
Is
Um,
this a community in need of, like, is,
Well, any Narcan training
Any.
is like good
Okay.
training because people. It's just, well, you get Narcan for free, number one, so you get 2 doses when.
whoever
train-
takes the training?
Gets free Narcan.
So then I would be able to offer
Yeah, and
Narcan if I
yes.
encountered someone
Yes. I-
suffering. I don't need Narcan.
No,
Well, I mean,
for
if
your
I
car,
do,
for your car.
for my
You're
car.
not supposed to leave in your car, by the way.
Even
But
Oh.
If you're interested, we can also provide, I don't know, I mean, how that you want to do like a board meeting of Narcan, but.
no, I did it for Boy Scouts, all right, and Girl Scouts, so.
We're also doing a regional health fair,
Mm-hmm.
that was mentioned last night.
Oh, yeah, that's,
Marianne was
that
doing
sounds good.
And we'll be kind of doing like a small, training there. for
I can tell you that looking for the future, we would probably definitely be interested in doing the vaccine clinic again for in
Yeah.
the fall. So if, I don't know how early we need to look at
No,
setting that
no,
up, but we definitely want to get that on board. Last year we offered flu and COVID. Did you do pneumococcal too?
I think, yeah.
I think so. So
Yes,
we definitely want to sign on for that because
Yep.
that is exciting.
For sure.
For you guys to help us.
Will be in the works for the fall.
Yeah.
And again, we'll be partnering with CVS because we.
Yeah.
That's a long-term goal of getting all vaccines. It's a whole thing.
I know, I don't know how we did it before, but it worked out. But yeah, so that's exciting.
Yes, yes.
But
I'm
Narcan.
trying to think, I think that's pretty much it. I know I mentioned the health fair, we got an epi intern that will be working with us in the summer, who would also be helping with outreach. A lot of the flyers, especially with ticks, I mean,
Mhm.
kind of probably heard, we got a testing result for West Nile virus recently,
Mhm.
as of today.
That and botulism,
Yeah,
from the
you know,
BOTAC.
Just so.
We get these
providing resources
updates, yeah.
and stuff like that, Yeah.
And I just, usually I try to, if it's like a real, like when we had the Triple E in the fall, they sent out flyers. So I'll take a screenshot of the flyer and then I'll post it on the social media website. But it was only it was like 4 or 5 cases of botulism and it was on the east, it was like
It was more
eastern
east.
Massachusetts. So I
Oh.
didn't post it on our social media because I don't want to freak people out
Yeah.
because it wasn't in our area. If it was in our area, I would have screenshotted it and posted it on the social media, which I also have to get you access to because we used to use it for like COVID numbers, but it would be like awareness days we want to be posting on there. anything
Yeah,
health
or like the
related.
health fair.
Yeah, the health fair, stuff like
Okay.
that. So,
Or even the CHA or the community health
Right,
assessment.
right. Yes, the survey, we could post that on there definitely.
Oh, yeah, I should post, because I do get the flyers in the email from, I
Mhm.
should post those on the Facebook page.
Right. I try to do it sometimes. I don't do it a lot, but when
What do you guys have, Facebook?
we do have a Facebook, like a Cam, OCAM, there's a lot of followers because during COVID, we would report the COVID numbers. So we just got a lot of followers, which is
I
from
think we
Aaron.
get a lot of social media presence on TikTok.
Oh,
and
yeah.
you
Oh,
make
my
some
gosh.
really fun reels.
Imagine doing, I know, that was something that I would. Like, I will.
Yeah, it's borderline.
I
It's
know.
tricksy.
Well, we have to be careful. There's a whole entire social media policy for the Ocam, town of Ocam. So we'd have to
I've
review
read
it
the code
before.
of conduct.
It's still. I'm gonna post, yeah, you know me.
Someone should definitely provide me that policy.
I'll find it out.
Okay.
Basically, you can't like use, like if you're posting on social media at one of for the Board of Health, you have to be like, this is terrible. Contraception is great, Ariana. You can't just say like that and leave it at nothing. You know what I mean?
Oh,
So
like,
you have to sign it.
be
That's
the
one thing.
voice
You have to
of-
have, it
yeah.
can't be like anonymous and stuff like
Okay.
that. That was one of the things. I can find it for you. Actually, I can have them send it to you because I don't know if the one I have is the most up-to-date
Okay.
one, but it's not super strict or anything. It's just
Okay.
like they made it recently and I think we should read it.
I mean, I work in corporate
Yeah.
America. I trust myself mostly.
And did you do all your, did they get you all those like conflict of interest law trainings, all
Yes.
those masks? Okay.
Yeah.
Those are so frustrating. I have to do them
Don't
twice
worry,
every
it's
year.
Oh, wait, no, the trainings?
The trainings.
I need to do that on mass.gov.
Yeah.
Okay,
Okay.
will do.
You do. I
Yeah.
didn't do it for 6 months, don't.
Okay.
Yeah, no, it's a goal.
Only because I do it at work every year and they wouldn't take it.
Excuse me, I work for the state of Massachusetts. It's the exact same training. I have to
I
do it
did,
twice.
well, that's what I said to her. I work for the state
Wait,
technically at UMass. I said I've
No.
taken all of these and then some, and they wouldn't take my certificate. I had to take it over.
All right, I have a hard stop at 7:40, so I just want to make sure we get through this.
Okay.
All right. So emergency emergency preparedness, did we already talk about that or no?
No, what,
Okay.
do we owe you something?
Well, you don't know me, you owe the state.
But how do we even,
So I know I sent, and I should have pulled out the list, but I know I sent, one of them was the drill. that was-
yeah, the email about the drill,
Or drill.
which is done,
Good, okay.
but
Perfect.
that's on here, giving you guys the password for the drills. I'm really sorry that the email that came from Gmail that said, hey Felicia, give me your password. I was like, I'm never,
Oh, so that's Jamie Terry.
yes, but I'm sorry, my husband's an IT guy, and I was like, in what right mind would I ever share a password in an email with an email that said, hey Felicia, because even though the person's name was Felicia, it's like. Anyway,
Oh, her
I don't
name
think
is really
it was
Felicia?
really Felicia, but I was like, you
Yes.
know what? I was like, I am not sharing the password. And then we never even got the request to do the drill because it went to you guys. And he said that. He's like, oh, it came to me instead of you, because whenever I see those, I do them right away. Because we only had one from March. It didn't come to me. He forwarded it to me. That's how I got it. So I would be glad to share the password about the drills, but I
My
don't.
question would be, I mean, if you guys, I just want to make sure you guys do get it because.
So I got it in March and I did it.
Yeah, yeah.
Then I was waiting for the election because I knew that Diana was not renewing, and that we had a potential new member. So I was gonna wait till afterwards and then try to update it. But then I got the bye Felicia email. I need your password. And I was like, nope.
What is this?
I literally wrote, I don't know who would ever give you a password in an email like this, but it's definitely not me.
Yeah.
So I really wouldn't. So then I was like, well, I didn't get a request for a drill because I looked through, I searched, I don't delete anything there, and it was not there. So he forwarded it to me and it said, I don't remember exactly what he said, but he said, oh, I got it because I'm doing them now. And I was like, okay, that guy, Terry,
No, Jamie. So
Jamie, is his last name Terry? I don't know.
I know. Very.
Anyway,
I'm
so
like, who is he?
is it a boy or a girl? I don't even know.
It's a woman.
Oh, sorry, Jamie, the woman.
Jamie, yes.
Two gender
Okay, so
ambiguous
she.
first and last name.
Right.
Okay.
Yeah,
That's weird.
it was weird. It was a weird
It shouldn't
situation.
go to us. It should go to the towns itself.
Usually does, and I do it every time, and it's always frustrating because when you try to hit confirm, it doesn't show up on your mobile, so you have to put it on your big computer because the confirm button doesn't. It's annoying. But yes, I don't mind if you guys want to do that. I can share the password when I have members voting for it, but I didn't want to do it without.
No, and to be honest, I was more like, okay, let me help out. Maybe
Mhm.
they're in, I don't know. I didn't even know that was happening, the whole third member. I was like, I'm surprised because they're pretty good.
Yeah, I usually do it. Right, I'm the one that does that.
Okay.
It's just follow the instructions.
Yeah, yeah,
but-
yeah. Okay. So I mean, if that was done, perfect, that's all.
It was.
And they wanted to know, or no, I'm saying he.
I'm sorry, I didn't know. I just assumed.
She also said that, I guess the contacts for the EDS,
We're not good.
some of them are, I don't know if, I mean, I looked online and
So
stuff.
I tried to add her in
Okay.
when I gave you the regular Board of Health email.
Mhm.
And I just put the town number here because you don't, it's not like you're having your personal number out there. So I added her in and I hit everything. But for some reason, it was showing like 24 pages of contacts, which I thought was ridiculous. So I kept hitting next
Okay.
and confirm and save. And when I exited and went back in, her name was there. So I don't know.
Okay, so just, I guess, just email Terry, I mean, Jamie.
Sorry, that's all my fault. I don't know.
Just email Jamie and say, Diana, it's out of the picture. Liz is on and this is her number. 'Cause
Okay.
I think that's the only update, I guess.
I updated it though. Did it not save?
No, I mean, not in the so that was the context. That was like,
Okay.
that was back in March. But she sent a different email saying, can you confirm these on a table? Can you confirm these are the right contacts?
Okay. Yeah, I probably waited on that because I was waiting for her to get.
Okay, so
I
then
actually
just-
may have emailed back and say we're waiting on the election.
Oh, okay.
Or if I,
So just
maybe I
say
thought she was female at that point, so I'm
Diana's
not
gone,
associating.
And this is her new member, and then that's it. I think that's the only, probably the only one. And there was another one. My brain.
Are the drills the same thing as the preparedness information, or is that two different
The
things?
drills.
It's
the
like-
part four drills is
It's
one.
an email. It's very weird.
And what else did I? There was three things.
Yeah, yeah. It says Jamie Terry. Yeah, I definitely thought that was a man. I don't know why. I just, It was a long. This is the instructions on how to do it. So usually if you get this email, I would do it right away, but this was not sent to me. It was forwarded to me from Jamie.
So I'm glad she clarified that. I hope that she changed.
Yeah, so it went on May 26th, because I had done one in March. On May 26th, it went from Jamie to Miss Seal or Miriam, Michelle, sorry. Oh, wait, that's you spell your name differently. I'm like, is that you? I thought your name was spelled different. And yeah, we never got it. And so then he forwarded it to me and I did it right away.
Okay.
So I didn't get it.
Oh, and then the ICS compliance status, that she didn't know if you guys have completed.
I don't know what that is, so.
ICS, it's the training for command system.
Probably
It's
not.
their command system, so I think that's all she wanted to know, if you guys had it or not.
Where is it?
No, did we
Like,
get an email? for
yeah,
that?
like, do they tell us to do it?
Cause that doesn't sound
Actually,
familiar.
May 24th,
ICS.
it's OCAM ICS, yeah.
I don't know. Might have thought it was junk.
Honestly, some of these do go to my junk email, and especially with JBT.
This is the same email about updating. Have there been any changes to the NIMS ICS compliance? I don't know. I said, I don't think so. I'm sorry. I'm the only member currently. So that was my answer to her.
Okay.
She asked me on, yeah, this was Wednesday, and I replied to her that day
Okay,
and said, I don't think so. Sorry, I'm the only member currently. That, because I knew Sue was, and she said, feel free to reach out if you have any. So if we need to do something, we can. I just don't know what it is.
so I would just say, this training, honestly, it's online training.
Where is it? Like-
It's online training, so when she emailed you, she provided that link to the training. And it's.
There's no link in this email.
Really? I see it.
I don't know. I hate the way this looks on my phone. Well, that was June 9th, actually. Sorry.
Okay.
Oh, this is.
Yes, that was the
24.
second email, yes.
Oh, reported compliance status. So I did say that Diana was gone. Oh, okay. This training. No, I didn't do that. We can do that.
Oh, do we all have to do it or just one person?
Probably just one person.
You're it. You
I
got
can
the
do it.
email?
I can do it.
For now, since you guys have just, or,
I'll do it. No problem. I just didn't realize.
but if you already emailed her, I don't know what she said, she didn't get it.
That's okay. I could have been confusing because clearly that happens sometimes. So wait, what did you say? We owe money to the state? I'm sorry. Didn't you just say that?
No, we owe the,
Oh, just those three
Um,
things.
we don't owe her. We owe the state.
Yeah, the state. Oh, it's just those three. I don't know why I thought it was money. That's way better. Okay, I'm like, we don't have any of
I'm
that.
sorry, we don't have any, but
Okay,
we.
so
we
I can do that.
try.
That'll be easy enough. All right.
Okay.
So you don't need the password for the drills. Okay, I'm sorry. I really am not trying to be mean or hard to work with, but if someone starts an email with, hey Felicia, and honestly, I didn't even look at who it was sent to. I was like, this is spam. This is,
Yeah.
you know what they did? The Commonwealth of Massachusetts, they sent out an email to all the nurses at our hospital and said, scan this QR code for a free coffee for Nurses Week. And it was a phishing attempt.
Yeah, they do that.
Can you even imagine that they did that during Nurses Week?
Nurses Week.
Oh, that's very bad.
It was so bad, by the way. I was like, phishing. So I thought that's exactly what this was. I'm like, this is a phishing attempt. They're trying to get my password. Anyway, I was just impressed. I knew what it was.
No, don't worry, don't worry.
All right. So, and then this meeting with the AG's office, you guys are gonna set that up, or who's setting that up?
So I'll email Mackenzie.
Okay.
And see if cause said she was
Would have no
waiting
idea
on
what
some
to do.
dates for them.
Okay,
Cause I said we had a new member coming on.
right,
I said, we haven't met in a couple months, so.
right. We had a meeting and then it was like the election and then it was like getting together.
Yeah.
All right, and the only other thing on here is fire
Oh.
station wants to use our trailer.
So I feel like he wants our trailer.
He wants to keep it and have it. We don't use it though.
No, I don't see why they can't
So if
borrow
we,
it while we're not using it.
so he
but-
did, this is the fire chief who has told us we don't use it, it just sits there, and he's not wrong. I think Aaron got a grant and got us a trailer so that if we needed to set up like an emergency, like- yeah, like we have
Yeah.
like a easy up and like
Mhm.
shelter. We could make a shelter, so we could put everything in it and set up a shelter somewhere. So all of the stuff I don't think there's actually, we used it when Sam had the house fire with all the donations. We put the stuff in there until we got it sorted. But other than that, we haven't really used it for anything. And all of the supplies we could keep in there, we can keep in either the fire station on the second floor or up here.
And
So the
they
trees,
want it for what reason?
what did he say? He wants to use it, like, because they need it, he's saying. Let's see, what
They
did he
want to
say?
fill it with by,
Okay,
I
hold
forgot what
on.
he said.
Oh, he also offered to come to the meeting and explain what he wants it for, which a few years ago, the Board of Health got a trailer. It was sitting behind the fire station empty for a long time. Last we saw, it was used for collecting clothing for Sam. If there's not a mission for it, the fire department is in the market for a trailer for all hazardous materials response stuff. Pads, brooms, speedy dry. If it's not being used, we would like to see if we could work something out. Or if you ever do need it, we can move anything. We could move anything, we could do it for you. So they're basically saying they want to borrow it, and then if we needed it, we could
They'd figure out how to help us.
they'd get it back to us. And the original work they had originally, when we got the request, asked us the same thing, and we were like, you can't have our trailer. Because they was kind of like, can we have your trailer? So in this new ask is, can we use your trailer because you're not using it for the town, which is what we're all
Yeah.
here for. And
Yeah.
if you need it, you can have it. But I wasn't comfortable making the decision on my own, you know
If
what I
they
mean?
have a demonstrated current need, I think that supersedes our anticipated
Need,
unknown.
100%.
It's
Could
not a
be,
need.
may not happen in the future.
Well, they are gonna
That's
put
what
this.
it is.
yeah.
They're gonna fill it with all their response stuff. If they happen to get an emergency situation, they're gonna use it.
Right.
It's not like there is an
But the
emergency
likelihood of an
situation.
emergent, like a chemical
Hazard.
is higher than us needing to set up a
Right.
shelter probably.
And anything that we would be responding to, the likelihood that they may
It
also be involved
Is
pretty high.
100%.
Yeah.
Yeah. So I would say that,
I don't see why we couldn't. I don't think we should give it.
no,
to
I
them.
agree that it
think
should
they
remain the
should
property of
Mhm.
Us,
the Board of Health, but that they can
And we
use it.
reserve
Yeah,
the
they can
right
use it.
Yeah, that we reserve the
to-
right to ask for it back.
Yeah.
So do you want me to explain that to him? I don't mind sending him.
I would document it. Just make sure you CC the BOH one
Oh,
so
yeah,
I can be
yeah.
on it, because I told him I would get back to him.
Yeah.
Because I literally have been just for one line replying to people. I'm the only Board of Health member right now, but I'm gonna bring it to the next meeting, so.
Yeah. Yeah. that-
Or I'm like, check the website for the application, you know what I mean? Because a lot of times we get emails that'll say like, where do I find my food? Or like even
Me,
like say
yeah.
you like, oh, hi, I'm opening a bread business. Where does the application? So I'm just like, mostly everything when Aaron set up the website is right there. So,
Mhm.
all right.
It's confusing because it says food establishment.
I know, yeah,
and I
it's not
wasn't gonna
right.
be like serving food.
Right. Yes, it is confusing. We actually even changed the permit for like a 1-day thing this year.
Yeah, we have a 1-day
We have a
permit.
1-day permit now, so you can just come in for a day and set up your shop and then leave. So that when people, like for like
Oh.
Oktoberfest, if we had someone come and they weren't gonna be doing like agronomy over and over.
Yeah.
All right. Anything to add, clerk report, your last one as the clerk? I know, well,
Nothing, I mean,
just general maintenance.
just general, we've had some food permits, some camping
So most of the
permits.
food stuff is for agronomy or for Pine Acres. That's where we get
Yeah.
the most stuff. And Treasure Valley, even though the address is in Rutland, we are responsible for that. So
Okay.
we'll get emails for the water. If you need to go, you can, obviously, you're have to drive far. This is the one place I don't have to drive far to get home to. So we get the water reports for Lake Dean, the campground there, and
Yeah.
for the Browning Pond. We get those in the email too. It's like Quabbin Analytical, it will say in the email, and it comes up with like the
Yeah,
water
I just
report.
put them on SharePoint.
Right, yeah, I just look at them, I'm like, oh, I don't see any red.
There is, I am supposed to report them to the state. I have an email. They just sent it to me like last year because I didn't know I was supposed to
Oh,
be doing it. So they sent me an email and
Okay.
said, oh, by the way, so I have to find that email. I think I'm supposed to upload them somewhere.
Okay.
But right
yeah,
now I
didn't
just
know that.
shove them into SharePoint
So they're
and
there and we
then
have
figure
them.
it out
Yeah,
after. So
none
we
of,
have
every
them.
once in a while, there's like a fecal count in one of the
Oh,
ponds and
yeah.
they have to like stop swimming at camp, but that happens everywhere, so there's not much you can do about
Yeah.
it. Other than that, we don't really have a lot of things we are dealing with here. There's like twice a year, we have to issue like a beaver killing permit.
Actually, I've issued it. Actually, you know what? Sign the back of this paper.
Sign it? What am I signing? The beaver permit?
Um. Well, I guess we have to figure out who's gonna be the chair, but right now you are. So the woman on Beechin.
So you can only get a beaver permit if it's like impacting your septic. So that if your septic is like gonna be compromised by what the beavers are doing, then we can issue like a permit for them to be able to kill the beavers. Other than that, we can't just willy-nilly be like, go ahead and kill your beavers.
Yeah, she's caught 7.
So yes, and it floods their whole property, and so that's the weirdest thing we have to do here. And
Okay.
then we get post-mortem reports too for when people in town expire.
Yeah.
But other than that, there's mostly food permits for us, and luckily we don't have a lot of like businesses in town.
Okay.
And they're done by, the inspections are done twice a year by Mackenzie. Yeah. So,
Yeah, the school, the
Yep.
campground,
yeah.
food permits, all the
48.
installer permits, septic, all of that come
The
here.
fees.
I send them to Phil and he goes and signs off and sends them back to me. And then all the fees, that come through either Unipay, that's the
Online.
online, or I get checks and we're very archaic here.
You
I
get-
write it on a piece of paper and put it in the treasurer's box.
It's like a
I have to
spreadsheet.
make
She
an
creates a
extra
spreadsheet.
copy because God forbid they sign it and make a copy. They have to sign 2 of them. It's very archaic. I really want to suggest that I could probably do it online because I have everything on and just email it to them, but
So she basically
This
makes a
is-
spreadsheet and prints it out with the
But
checks
this is
attached,
OCAM.
and then.
yeah, and OCAM's in the archaic days, but
It's okay.
Which is
I work on it.
kind of why I wanted to get involved, but.
Right, yeah. So that is
So we're lucky the Board of Health does take
I have to
payments
go
online.
in 2 minutes.
Okay, does
Sorry.
take payments.
Yeah, they do. That was new.
So I think
I have to click.
I think, Liz, once you get your email and access to SharePoint, I mean, I can meet you up
Yeah, we
here.
could do like.
I work in home
orientation.
Thursdays and Fridays. I can
Yeah.
meet you up
There's
here and I
actually
can
a
show you,
competency.
Okay.
and I can,
Which we developed, but it's pretty vague, but we have that. and We
Yeah.
can go over
I
it.
can go over everything that I do. I can show you where everything is. That way, if I'm not around and somebody needs something, I can show you how everything's laid out in SharePoint, how
Okay.
everything's laid
Yeah,
out
'cause
in
I'm
the
close,
cabinets.
And most days I'm.
Mhm.
Your
working
home,
from
yeah.
home.
Cause I'm always like, okay, on my way home from work, I'll stop, or my way before work, I'll stop and look for it, scan it in and send it to them. So
Mhm.
I kind of work around my
Yeah.
full-time work, so. So we could set up a time once
Yeah.
you get all that
Okay,
access.
I'll work on that.
All
ASAP.
right, yeah, and I'll email Maribel and the
Okay.
Board of Selectmen about access and appointment.
Got it.
And
And we'll
I'll
just
follow up
keep
with that
things-
training.
And we'll just keep things running.
All right, sounds
Thanks to
good.
Lester and Phil and
Yeah, agreed.
us.
And you.
The 3 of us.
All right,
Well,
do we have anything else? So we'll adjourn there.
yes.
All right,
Thank
sounds
you.
good.
Can you, I think you have to hit something on
Stop.
that, stop.